What's up? What's up? I'm Dr. Omatma, host of Egg Meets Sperm, where we're busting fertility myths, sharing tangible tips for your fertility journey, and bringing you the most knowledgeable guests to support your journey to parenthood. This podcast is for both women and men because getting fertile as fuck is for both partners, don't you think? Remember, just listening to this podcast won't get you pregnant, but following the tips we share just may. Let's get you fertile AF so that you can co-create the family you dream of. And if your partner's not listening to this, make sure to share this episode with your partner. Hello and welcome to Egg Meets Sperm. My guest today is a total badass. Her name is Trina Felber. She's the founder and CEO of Primal Life Organics. She's a registered nurse with a master's degree in anesthesia. Trina disrupted the beauty industry and exposed the hyper-toxic personal care products poisoning us by Big Cosmo. She started her natural dental and skincare company in 2008 and puts her nurses' care into every product she makes. Trina is a multi-million-dollar entrepreneur and the best-selling author of Beauty's Dirty Secret. She has made Inc. 5000 lists 5 years in a row and has been featured in Dr. Oz, Paleo Magazine, ABC, CBS, NBC, Fox affiliates, and on hundreds of podcasts worldwide. Thank you so much for being here with me today, Trina.
Oh my gosh, I'm super excited to mouth off with you today.
Great. That's the kind of podcast I love the most. So that's really exciting. And I know that our listeners are already like, Primal Life Organics. I know we've heard Dr. Omatma talk about why we need cleaner beauty care products, but the direction we're going in with our conversation today is the most unique conversation ever. And it's going to blow y'all's mind. So let's get into it. Let's start with oral health, right? Like that's what you're all about. What is it about oral health that is impacting the rest of our bodies?
It's so funny. When I was growing up, I remember hearing the phrase, good health starts inside your mouth. It never dawned on me. I never knew what that meant, never cared, didn't think anything of it. And then it recently, after I started the business and started exploring more about overall health, it made sense to me that everything is linked to your mouth. It's the gatekeeper for your health. And if you don't have good oral health, most likely that is where health stops for you. It's where you can turn it back around, you can change it, but good health starts inside the mouth because every system is linked to it. Your microbiome inside your mouth, the bacteria, if it's not healthy, can cause inflammation throughout the rest of your body. So really the link is the bacteria, but the inflammation can get into your body through your gum tissue, through swallowing it, through your sinuses, through breathing it in, all sorts of ways.
Yeah. So basically inflammation related to the bacteria in our mouth.
Correct. Yes. And that's the link between like heart disease as well, Alzheimer's, thyroid disease, diabetes, and we'll talk more about infertility, preterm labor. And, it's not just for women, it's also men, and their fertility is also related to the bacteria inside the mouth. And the problem really is that the dental products on the market are creating this whole cascade that increases the inflammation inside our mouth, increases the wrong bacteria, causes more inflammation in the body, which then spirals into all the health related issues that I already mentioned.
Wow. Yeah. So holy moly, we're going to unpack this. So tell me, in terms of fertility, because you just said that the oral microbiome can impact fertility for both men and women. So y'all, if it is the woman, which most of our listeners are women, but you guys need to share this episode with your partners because this is just as important for them.
Totally. And for women, there was a study done in Australia, not a huge study, but a study of around 3,700 women. And they actually discovered that women that had dental disease, it took approximately 3 months longer to get pregnant than women that did not have any kind of dental disease. And that's pretty significant because, depending on the severity of dental disease, and for the most part, many people don't even realize that they have dental disease to some degree. I always tell people the first sign that there's an imbalance in the bacteria inside your mouth is bad breath. You should not have bad breath. It's not a fact of life. It is a signal to your body that something's not right. There's an imbalance between the good and the bad bacteria inside your mouth. So infertility, it's related to the bacteria, and it has a lot to do with the fact that the body's immune system and how it could possibly react to embryo implantation. So right there, the inflammatory markers, you're trying to get pregnant. If you have high inflammation going on in the body, the chance the embryo will implant and be sustainable is lower, a lot lower. That's for women.
Wow.
And for men, it's all related to the inflammation from the bacteria as well that can reduce sperm count. It can affect sperm motility so that it's not as mobile. No, they can't get there. Can also affect the morphology so that they could be abnormal in morphology. So lots of different types of things that can happen, but it's all related to the bacteria inside the mouth.
Wow. So bad breath. Now, I'm assuming you're meaning like general and not necessarily like first thing in the morning before you brush your teeth, or are you referring to that as well?
I'm referring to everything.
All of it.
I mean, really, when you go to bed, your whole body, as you know, goes through a detox. So it's going to do this like auto cleansing. Part of the problem with your mouth is if the wrong bacteria is in your mouth, if you have a white coating on your tongue, if you have plaque and gingivitis, that bacteria continues to feed itself because it's creating its own environment. And that bacteria likes an acidic environment, and that acid will continue to feed that bacteria. It's not going to help it get better overnight. Obviously, you wake up in the morning, you're like, let me brush my teeth. It's gross. If you really have a healthy bacteria inside your mouth and you have a good balance, you really should not have bad breath. The only time you really will get that sour taste is when you're a little bit dehydrated. Sometimes, when I do talks or podcasts and I don't drink as much and I'm talking a lot, I will notice that my mouth starts to get a little sour. I take a drink of water, but that's related more to being slightly on the dehydrated side. But typically on a normal day, I do not have bad breath. I do not need breath mints. I don't chew gum. Those actually make things worse in the long run.
Can we please talk about chewing gum and like the mints and the stuff that people are putting in their mouths? Because like, not only is it affecting the microbiome of the mouth, but then you're also like, most of these gums have alternative sweeteners, which then you're ingesting, and that's also linked to fertility issues. So can we talk about that for a second? Because I think that it's like, I'll admit, like as a provider, I don't talk about it enough with people.
And you're not alone, which is one of the reasons I love talking like this, getting in front of people and telling them, what's really going on, because it's not a topic people think that is even an issue. When you put breath mints in your mouth, or you take some gum and chew some gum, your goal is to have fresh breath. And obviously that's what they know. It's going to be minty, your breath is going to feel good. But in the long run, like you said, you're going to have artificial sugars, which are going to impact not just what's going on inside your mouth with the bacteria, but it's going to impact your health in other ways, because your gum tissue is highly absorbable. It has a lot of blood vessels in it. The blood vessels inside your mouth, they take the blood and anything that it absorbs throughout your body, not directly to your liver. Unlike when you swallow something. So say you're chewing your gum, you do swallow everything inside your mouth, you swallow. Believe it or not, that's the one thing that it kind of can be gross if you think about it. Every single thing inside your mouth you swallow, unless you're spitting constantly all day. So everything goes down into your gut. Your gut has this natural built-in mechanism to detox your body, and that's your liver. So if things go to your liver, they can be converted to something that's more water soluble that you're going to excrete in your urine, or you're going to pass through your digestive system. But unfortunately, your mouth, if you end up with any kind of, I call it leaky gum syndrome, where you're, instead of leaky gut, it's the same thing. Your gum tissue is red. It's inflamed, it bleeds, especially when you floss. that's just a portal of entry for bacteria and all sorts of toxins to enter your body. So gum and any other toxins that might be in it will get absorbed into your bloodstream through your gum tissue and then travel throughout your body because it goes into your blood vessels, which then go back to your heart and your lungs. And then from your heart, it gets pumped everywhere. So a very small percentage will go to your liver. Everything else goes everywhere. It goes to your brain. It goes to your intestines. It goes to your uterus. It goes everywhere. So we really have to pay more attention to what we're putting in our mouth. And gum and breath mints aren't necessary if you have healthy bacteria inside your mouth.
Okay, this is brilliant. So it's literally, you're blowing my mind on so many levels because as a provider, again, I'm just thinking about all the people that I've not had this conversation with, and maybe we should be maybe this should be at the top of the list as we do a review of systems. So yeah, thank you for sharing this information. What about oral health and pregnancy outcomes?
I know this is a good one that can blow people's minds too. Pregnancy and preterm labor can be directly related or affected by the bacteria inside the mouth. Same reason, the inflammatory response, the bacteria that's inside the mouth that's harmful creates inflammation, and the inflammation within the body, and it really depends on where that inflammation goes, what's going on. So for pregnancy, obviously, body is sending all the signals that it has to try and support a pregnancy. So that's where a lot of these inflammatory things can cause a lot of changes or damage. I always like to tell the story. This really is impactful. There was a friend of mine, she's a chiropractor. She had a good friend of hers that was pregnant and went into preterm labor very early. She was in around 26, 27 weeks, too early for the baby to really survive. So they took her in. She was put on what we call Trendelenburg. So her feet are up in the air more and her head's down, trying to keep baby, in place while they put her on magnesium to stop the contractions. She was in this position for 2 to 3 weeks. They weren't really able to stop contractions. And finally, someone looked inside her mouth and saw she had either an abscess or something going on. Her gum tissue was really inflamed and swollen. So they had a dentist come in, do an exam, and he put her on an antibiotic to cleanse and clean the tissue. And within about 2 weeks, she was able to go home and she carried the baby full term. It stopped the preterm labor. The preterm labor was being caused by the bacteria inside her mouth. So that's just how impactful it is. It's not difficult to change the bacteria inside your mouth. But again, the products that are being sold on the market are products that have ingredients in them that I like to say are like antibiotics. Triclosan, alcohol-based mouthwashes, peroxide, and then the harsh ingredients that are found in toothpaste, including like sodium lauryl sulfite and the things that cause that deep cleansing. They're killing everything. They're not just killing the bad stuff. They're wiping out your good bacteria. So it's like taking an antibiotic, and we take antibiotics. I think most women, have taken at least one set of antibiotics, and you realize what it does to your gut after taking it for 7 to 10 days.
Years to recover from that. Years.
It can totally. And so when you're brushing your teeth with something that's killing and wiping out your good bacteria twice a day for life, and you expect to have good dental health and then good health beyond that, it's like taking an antibiotic twice a day. You're wiping out your immune system right there inside your mouth. So you have no chance. And it's easy to change. It's easy to switch. Your body is always trying to get back to normal, trying to keep you healthy and keep you safe. But we have to change the things that we're using, because if we don't make any change, we're not going to change what's happening inside our mouth at all.
Mm-hmm. So a couple of questions about this. Is it enough to say, okay, I don't have bad breath, I don't have red inflamed gums, I don't feel any abscesses, and I've switched out all of my products, hopefully, to clean things? Is that enough? Or is there like some active testing or things like that people need to be doing to ensure that they have good oral health?
I think it's a start. Like the best start is to change the products that you're using. And I can go into what really you want in your products, what you want to look for. because there's so many things out there that will get the job done and they will be better for you than what is on the most of the supermarket shelves. But they're not actually going to be long-term creating whole health inside your mouth, which means really strong enamel and then bacteria that is healthy instead of bad, and then strong gum tissue that is not leaky or not bleeding, not inflamed. There are tests that can be done for the bacteria inside the mouth. If you see a holistic, I usually recommend that people try to look for a holistic dentist or a functional dentist or biological dentist in their area. They will be more in tune with the healthy bacteria and how to maintain that. Some of them also will do an oral swab or a microbiome test to see. And then they can tell you what bacteria is in there and what it's linked to. I mean, there are some bacteria that's directly linked to heart disease, directly linked to certain things. But overall, if you are using good products and you have good breath and you're not noticing bleeding or sensitivity to the teeth, you're on the right track. At least you're on the right track.
Wow, there's so much here. So you talked about strong enamel. And the question that came to my mind was, okay, so what about fluoride? I'm sure that's a can of worms that I'm opening, but I'm okay with that if you are.
Oh, I'm totally okay with it. You know, I always tell people keep an open mind. The first thing I always like to say is I do not recommend fluoride. And since this is your type of topic about pregnancy, a baby truly should not be born with fluoride in their body. We are not supposed to have fluoride in our body. It's something that has been put there from the environment or from the things that we have been putting in water or toothpaste or products or whatever. The only way a baby is actually born with fluoride in their body is if mom had fluoride in her body and it's passed through to baby. And fluoride internally causes problems. It's not meant to be there for a reason. It's a neurotoxin, and it's just not something that you want to deal with. Nobody needs to have any reason for their body to have any neurotoxins in it. You know, that's your whole neurological system. It can cause problems with your bones, too much in your body. Fluoride tends to replace the minerals that are found naturally in the body and the teeth. So it's going to replace the calcium with a fluoride. And unfortunately, if this continues, because there's more fluoride in the body than the body can get rid of or know what to do with, it will store it in the bone and the teeth. The idea behind it when fluoride first came about was that fluoride was going to make the teeth cavity resistant, was going to make the teeth stronger. If that's the case, then why have we not seen a decline at all? I'm not even talking like a slight decline. We haven't seen any decline in tooth decay and cavities at all since fluoride was added. It's not necessary. It's not needed. Your teeth are actually stronger than your bones by nature because they have to be. Your teeth are made up of the exact same minerals as your bones. And the reason that your teeth are less or more affected, I guess, if you will, and you can get sensitivity in cavities is related to the environment inside your mouth. So if your mouth, like we were talking, has good bacteria, your mouth is going to have more of an alkaline overall pH to it. Your saliva is supposed to neutralize your pH. And, you know, we can talk for a minute. If you're interested, we could talk about why women, after they go through 9 months of pregnancy, end up with possibly having a cavity. A lot of women say that they have a cavity for every baby born. And that's a lot of times, I believe it's related to your saliva. But your saliva is what's supposed to neutralize acids in your mouth. But if we're constantly eating food that's acidic, and we're brushing with things that are acidic and we're wiping out our good bacteria and only replacing it with bad bacteria, your saliva can't function. It can't protect you. And that's really the body secretion that is, that no one's talking about, that is your first line of defense against a lot of things. Your saliva has proteins in it that are antimicrobial, they're antiviral, they're antifungal, they're supposed to kill things. And if your saliva can't function correctly, you're just opening yourself up to infection and inflammation throughout the body. So, yeah, do you have anything you want to add at this point before I keep?
Yeah, gosh, there's just so much here. I feel like it is the fluoride thing kind of led us down a path historically that maybe wasn't as helpful as it should have been. And the proof is now available, right? So like we just have to listen to the evidence in some ways. But there are doctors that, or dentists that are still like, what? You're not using fluoride toothpaste? They flip out every time I tell them that, right? They're like, oh my God.
Well, yeah, it's crazy. I know my dentist, we take my kids to the dentist that's right near our house, and he always wanted to do fluoride. They've stopped asking us. My kids are 14. My daughter's 14, and I have twin boys that are 12. And we just had their checkup, and between the three of them, they have zero cavities. I mean, when I was their age, I had a mouthful of cavities. And they're, 12 and 14, and they have zero cavities at all. My daughter, actually, this is interesting. And I don't know if you've ever heard of this, but when my daughter was 2 years old, the reason I got so interested in dental health was because when my daughter was born at the age of 2, when her molar came in, she had a molar that came in that had a natural cavity in it, had a defect. We were brushing her teeth. We saw this something looked like a cavity. She wasn't really complaining of anything, but we took her to the dentist, and he took a look at the tooth, and he said, that's a natural defect. It's a natural cavity. Happened in utero. Normally it happens to both teeth, like both molars, because they're being developed at the same time. Hers was just one. Happens sometimes because of inflammation, because of bacteria, because of stress, anything, a high fever, something like that. But nonetheless, he said, we'll fix it. We'll put a temporary filling in it. The temporary filling is going to probably fall out every 2-3 months. And every time it does, we'll decide if it's time to pull the tooth. He said chances are really good. He expected to need to pull the tooth within a year. So I was leaving the dentist office. I know that every tooth is connected through a meridian to an organ. And so I'm a little upset. I can't believe this is happening. She's 2. I don't want to put her through all these, fillings and things. And as I'm leaving, he says, don't worry, Mom. We put a temporary filling in it. Now we just hope for the best. And I thought, oh my gosh, there is no way I'm going to hope for the best. So I started doing my research. I found Dr. Weston A. Price, who was a dentist in the early 1900s, who was way before his time. He is the one that connected sugar in the diet to an increase in cavities, and really wanted the ADA to cut the sugar in the food and recommend low sugar. And the ADA did not want that. So his research basically is what I used to build my entire dental protocol from. And my daughter's tooth, the one that was supposed to be pulled within a year, fell out naturally at the age of 12. And the original temporary filling that was supposed to last 2 to 3 months was still intact. And the tooth had actually remineralized over that filling to protect it from getting bacteria underneath and needing to be pulled.
No way.
Yeah.
That's incredible. That is so incredible. Okay. Thank you for sharing that. That's just like, what a beautiful story. So
it's crazy. You don't realize how impactful what you're using. I know for sure if I had not switched what we were brushing her teeth with, that tooth would have had problems from the day that we put that temporary filling in.
That's amazing. I know you have some important information to share about nitric oxide, which is another one of my obsessions, because there is a lot of research coming out about how it's connected to fertility. But what's your take on it, and how does it connect to oral health and fertility for you? Or at least what you've seen.
For oral health, yeah. I mean, fertility is obviously all about blood flow. Right? It's all about making sure that there's blood flow to every organ that is needed for a baby to survive, for actually an egg and a sperm to meet, all of that. It's all about blood flow. And nitric oxide is a vasodilator and increases blood flow. So obviously, any time that there's less nitric oxide being produced by the body, there's less blood flow that is going. And you have to stop and remember that your body's going to prioritize organs. So it's going to prioritize organs that are your necessary organs, like your heart, your lungs, your brain. And then it's going to shunt the blood there more than other organs, just for survival. As far as the mouth is concerned, it's really interesting. If the bacteria in the gut and the mouth are not healthy, nitric oxide will not be able to be made. Nitric oxide is produced in the body between the saliva, the good bacteria in the mouth, and the bacteria in the gut. If any of those are out of balance, then nitric oxide production will decline significantly. So if we're brushing twice a day with something that's killing our good bacteria, the bacteria that's required in order to make nitric oxide. And we're swallowing some of that because no matter what, even if you will swallow, they've done testing, you will swallow your toothpaste. And they have done testing, especially on triclosan. And they found that triclosan will cause gut dysbiosis, which is the imbalance in the bacteria in the gut, just from swallowing a very small amount of toothpaste. So you're brushing with stuff that's destroying your good bacteria, not just in your mouth, but potentially even your gut. Okay. And your body's not able to make nitric oxide like it's supposed to. So then everything else is going to start to decline. That's why heart disease is also linked to your mouth and the nitric oxide not being able to be produced to vasodilate your coronary arteries. But when we're talking about fertility and the connection, I'm going to read something just because it's got some words in here that I don't want to mess up. But this is the connection between nitric oxide, fertility in your mouth. In females, nitric oxide stimulates an inflammatory cascade to induce ovulation, decreases in luteal and granulosa cells, and acts as a paracrine factor to mediate reproductive cycles and implantation. So basically, your entire fertility cycle is based on nitric oxide, and including the ability to implant an embryo. In males, nitric oxide is a key player for steroidogenesis, erectile function, sperm capitation, and acrosome reaction. So basically for men and women, it's extremely important in fertility as well as pregnancy to have good nitric oxide production.
Yeah. Good blood flow. Yep. And it's also important for orgasms.
Right? Yeah. Without it, right? Yeah. Mm-hmm. So important.
Cool.
And no one's talking about it.
Yeah, exactly. Okay. More questions for you. Oh my God. Like I could pick your brain for hours. I'm curious about all the things that are being done to our mouths, starting with braces, fillings, cavity fillings, veneers, teeth straightening devices like Invisalign or whatever the different companies are. I'm curious your thoughts on all of those things.
Well, if you're going to ask me about like the Invisalign versus braces personally, and I don't have anything like that, any studies that I've done or seen to back this up. This is just me looking at what those both do. I personally think braces are better because you're not covering everything up. I don't like the fact that you're putting this one piece completely covering the teeth and the gum tissue. I don't like the bacteria can harbor in there. But with braces, I've had really good effects from customers or clients that have used my products brushing with my tooth powder. When they get their braces off, their dentist or orthodontist is shocked at how good their teeth are, the condition of their enamel is. So I think that more important is we have to talk about the structure of the mouth, the tongue position, because truly, if we were promoting a healthy structure, healthy tongue position, that would alleviate some people from needing to have dental work done in the first place, because your tongue position will dictate not just the way your mouth forms, but will also dictate your posture. If you have a tongue that's sitting at the bottom of your mouth, so it's not at the roof of the mouth, I have, let me grab my mouth. If you guys have any video capability, but
yes.
So anyway,
we will put this in a separate video.
Yeah, so you have your mouth, and your tongue should not be positioned at the base of your throat. It really should be positioned behind your palate up at the top. So there's a ridge at the top of your mouth, right behind your teeth. So if you go back, you put your tongue behind your top teeth, and then you sort of slide it back where you feel that ridge right at the back of that ridge, and you hold your tongue up there, but not just there. You want to kind of that piece of your tongue, but also the back part of your tongue. There's some exercises you can do, but if you notice when you do that, so it's going to be way back in your throat, you're going to lift your tongue all the way up to the top of your throat. You will notice that your neck will elongate and your head will actually become in a neutral position. That is one of the things that, when people have neck pain, one of the things that they can do is actually their tongue is probably weak and is sitting. And it also causes your facial structure to flatten, and it'll change the structure inside your mouth. So tongue position is extremely important. I'm not against corrective things because, you know, you need to be able to breathe. But I think if we did more preventative and made sure that, you know, I wish the dentist, like, it makes me so mad that the dentist won't do these types of things because this is so easy. It's so easy to prevent cavities. It's so easy to prevent gum disease. It's easy to teach kids or adults to do these types of exercises to even screen for this stuff. And it's just not being done.
Yeah. There's a cool bonus, which is if you are touching your tongue to the roof of your mouth, that activates the parasympathetic nervous system. So
you're right.
It's also like getting you into a more relaxed state, which is great for fertility.
Yes. And you have to think about it this way. When babies suck their thumbs, their thumb is pressing on that spot right at the top of the mouth that induces parasympathetic nervous system. So it's calming them. That's why babies actually suck their thumb. So by pushing your tongue up there, you're basically what you just said, you're activating the parasympathetic. So it's just that calming. It's going to calm you down. You can't really put yourself in a parasympathetic state if your tongue is down. So a lot of times people get stuck in that sympathetic fight or flight, but by pushing their tongue up can actually induce that parasympathetic response.
Wow. This is so good. I cannot believe it. Like there's so many connections here on how to improve fertility just by focusing on this little thing called the mouth.
Yeah.
I love it. Sorry. So veneers, yes or no?
I don't.
Thing, right?
Yeah,
it's
a thing. And I don't like veneers. Yeah. And really what they're doing is they're shaving down all of your enamel. And then for me, no.
Yeah.
It's not good.
Yeah. It's one of those things that like so many people, like it's becoming a status quo and it's kind of scary to me. Like, do we know how this is going to affect us in the long run?
Yeah, we don't have those answers. And, you know, I've seen people that have had the veneers or wanted to get them removed and your teeth are destroyed. Like you can't go back.
Like you do it and then you're getting another set of veneers. Like, don't think you're going back to your regular teeth after that.
Yeah. And you have to remember that your teeth are connected to an organ. Every tooth is connected to an organ through a meridian. And I don't know how that affects it either. You're actually like putting a cap over and, you know, if it's necessary for a crown, that's one thing, but putting that over all of your teeth, I just don't feel that it's beneficial to the body and to your health. I think that there might be more problems down the road than we know.
That was my internal like intuition about it, but I was curious if you had thoughts on that too.
Yeah.
So the last one is teeth whiteners. They have the chemical ones, which I'm assuming are like just a no-brainer, like don't do it. They're mostly chlorine based from what I've seen. There are some natural ones that are like coconut based. Have you seen those? What do you,
I make a teeth whitener. Yeah, I make a teeth whitening.
Okay. Well, that's easy. We're doing yours because I know you've already.
But this one's mine for any video that you might have. So this is my teeth whitening system. I use red and blue LED light on the mouthpiece.
Okay.
And that is going to, the red light, when you talk about red light therapy in the gum tissue, red light therapy does the same thing for the gums as it does for the skin. It increases blood flow, reduces inflammation, and then stimulates collagen production, which is extremely important. Even during pregnancy, I've had women use this as well, because during pregnancy, a lot of times everything sort of gets inflamed. And this can be calming for that. So the red light therapy is for the gum tissue. The blue light helps to kill bacteria. We were talking about the bacteria causing all the problems. It's the inflammatory issues internally that come from the bacteria. Harvard did a study, and when bacteria that's harmful, I've got my little props. When bacteria that's harmful inside the mouth is exposed to blue light, it's got this little portion in it that explodes. And when that little piece inside the bacteria explodes, the bacteria is dead and it kills the bacteria. Nice thing about light therapy, both red and blue, is that it penetrates the tissue. It's not just a surface, it's going to penetrate the tissue. So it's going to actually be able to possibly get between the teeth to some degree and into the pockets to some degree so that you can then affect the bacteria that's there as well. The gel that I created is peroxide free. You talked about the chlorine and peroxide. Not good for the bacteria inside your mouth, not good for your gum tissue as well. They both irritate the gum tissue. peroxide works, it's really interesting. Peroxide works to whiten the teeth by pulling out some of the moisture out of the layer beneath the enamel. So underneath your enamel, there's a layer called the dentin, and the dentin has some fluid in it. It's like your shock absorber, because inside the dentin, you have what they call the pulp, which is your blood vessels and your nerves. And so your dentin is sort of protecting your pulp so that those irritants don't get into your body or cause damage to the nerves. There's some antimicrobial properties to it as well. It does have some hydroxyapatite or calcium phos. So it does have some sort of substance to it. It's not completely fluid. But how peroxide works, the problem with the dentin is when your enamel gets so thin or thinner as we get older, if you're not replacing the minerals in your enamel, it's going to wear down. If it wears down, it sort of becomes see-through or paper thin. When you start to see the bluish tinge or the yellowish tinge or the grayish tinge to your teeth, typically that's because you're starting to see the dentin. The dentin layer is an off color. It's the gray, the blue, or the yellowish tinge. Peroxide pulls the moisture out of the dentin. When it does that, it causes it to be more opaque. So your teeth almost instantly look like they're whiter. But the problem is you've just weakened the structure inside of the tooth. That is now going to create more problems. Your teeth are going to be weaker. You're more apt to having cavities or chipping of the teeth or breakage of the tooth. So peroxide is going to damage it. And then it hurts. Peroxide hurts because it's caustic to the nerves. So once it's inside the dentin area, it doesn't take long before it travels to that pulp area, which is where your nerves are. And that's why peroxide hurts. So what I did is I wanted to create a whitening gel that actually will work long-term to strengthen your tooth. Since your enamel's the whitest part of your tooth, and when it's white and thick, it's healthy and your teeth are cavity resistant. That's my goal was. I wanted to destroy the bacteria with the blue light. I want to help increase the gum tissue with the red light, but the gel has olive oil in it. It's an olive oil base. So olive oil is really soothing to the gum tissue. Then it has some hydroxyapatite. Hydroxyapatite is better than fluoride because it's exactly what's in your teeth. It's exactly what it's calcium and phos, what your enamel is made of. And then it also has 2 clays in it because clays are very beneficial. They not only have the minerals in it, but they also help to pull toxins out of your gum tissue and your teeth. So by using that with some essential oils, it's going to help to rebuild the enamel, make your teeth thicker, stronger, and whiter the way that they're supposed to be long-term. That way, when you go to the dentist, you're not going to have issues with your gum tissue or the thickness of your enamel, like sensitivity. I've had people reverse sensitivity. Teeth that have been sensitive for years and years will switch to my dental protocol, and they say 3 days and their teeth are like no longer sensitive. They're blown away. They're like, I've been dealing with this for years. I had no idea.
I love this so much. And I'm like, I need to go buy this LED whitener like today. So I will be going online, getting this for myself. And I know that you have a really amazing discount code for our listeners, which is so generous of you.
Yeah, I'll get you the link. I'll get you the link. As long as they click through the link, then they'll get the discount. It's 60% off.
Awesome. Yeah, that sounds awesome. So this has been one of the most interesting conversations because it's never talked about, and we need to have these conversations way more often. So I know that our listeners will be tuning in for the rest of the week for your amazing tips. I thank you so much for being with me today and for just taking extra time because this went way longer than we usually go. But this was a riveting conversation, honestly.
Yes. And thank you. I appreciate it. The more people that can make the change in their mouth will change the world because of the babies being healthier and mom and dad being healthier too.
Yeah. Yeah. Thank you. Was that an amazing episode or what? Make sure to check our show notes so that you can link up with our guests. And if you're not a part of our secret Fertile AF community, you can join for free via the link in our show notes. Last but not least, have you showed us some love lately? It would mean the world to us if you could share and review our podcast. Thank you so much. We'll see you next time on Egg Meets Sperm. Peace.